So today the grafts are very loose, so you have to be very, very careful that you don't knock them off. So the moment you go from here to your hotel room, the first thing you're going to do is remove the cap. Okay? So there will be no dressing over the planted area. The dressing will only be in the donor area, that is the back. Okay? So you have to be very, very careful. The grafts are at very high density. I'll show you. Okay? So that you don't knock them off. There is nothing holding the grafts down. There is no blood clot which is formed. If the grafts come out, there will be a lot of bleeding and you would have lost that graft. That graft is not available. Okay. You can't put the graft in. So you'll be very careful. The moment you go to your hotel room, take off your cap and start spraying. We have given you 2 bottles. Spray bottle, one contain. Very careful that you don't knock them off. So the moment blue for blue cap, okay? And saline spray. The saline spray is to be sprayed from a distance of 2 feet every 20 minutes.
Okay.
If you are too close, you might knock off the grafts. Okay? Don't spray the blue spray because blue spray is poisonous for your hair. So this every 20 minutes till you sleep at midnight. Okay? At midnight you stop doing the spray every 20 minutes and you can go to bed. But on bed you have to put your head on 2 pillows. Over the 2 pillows you spread this sterile towel. Otherwise you're going to stain your pillow and the hotel is going to charge you for it. Okay? But best is tonight to sit on a reclining chair and watch TV. Sleep very late, say around 4 o'clock, 5 o'clock. It's always better to sleep very late. Okay? Watch TV. You can be on the laptop. You can be on the phone. But don't go anywhere. Okay? And don't consume any alcohol tonight. You can eat anything you wish, but don't go to the restaurant. You order food into your room. There's room service to do that. Okay? So we have done your no shave technique. We shall be changing the dressing now. Tomorrow morning you'll come at 9 o'clock for a change of dressing. And we'll also explain to you tomorrow the care for the next 6 months. Today being the most crucial day, it is very important for you to know the care for today. Leave the care for the next 6 months for tomorrow. So we're giving you a cap. Make sure before wearing it that it is spread out completely, otherwise this will rest over your grafts, okay? Before wearing the cap, spray inside with the antiseptic, the blue fluid that we've given you, spray, okay? The cap is to be worn only while going to your room, okay? In the room, you have to remove the cap. Cap is the worst enemy tonight because it can easily remove your grafts, okay? The cap will protect you from the dust, from the water and from the sun, okay? How to wear the cap? Just have a look. The cap should come from behind forwards, staying clear of your grafts and rest on your brow. This is your brow, okay? If it is not resting on your brow, it is resting on your grafts and the grafts will get stuck and come off the moment you remove the cap. Okay? So to remove the cap, hold this with your left hand and with the right hand, pull up the back portion straight up, like a seesaw movement. Okay? If this is your hand, your cap should come like this and come off like this. Never do this or this, otherwise the rim will get hold of the grafts and they'll cap off. Okay? So I'm putting the cap from behind forwards. Do not adjust it, don't shake your head too much because it will remove the grafts. Okay? That's it. Hi, this is Dr. Bhatti and I'm going to today teach you the shampooing procedure. Now that your hair transplant is over, we have a care of 2 weeks post procedure which you have to follow for best results. It is only the first 3 to 5 days which are intensive. The rest of the care is pretty simple. So yesterday after your procedure, you went back to your hotel, took some medicines and was spraying your planted hair with saline spray every 20 minutes. Today you have decreased the regularity of spraying your hair once every 2 hours. So now I'm going to explain to you the remaining care. We have on our left the shampoo material, that is the saline bottle, a pack which contains sterile gauze, a plastic bottle with pink shampoo in it, and a needle, sterile needle with which to make a hole in the saline bottle. Now you have to do, as you all know, you have to do shampooing morning, evening, as has been just explained to you. And the saline spray has to be done every 2 hours. This care will continue till day 4 after the procedure. Today being the first day after the procedure, it will continue till the 4th day. On the 5th day after the procedure, you will stop the 2-hourly saline spray. Now the saline spray which was keeping your hair moist after the shampoo procedure has been stopped. So what is going to keep your hair moist? You are going to use instead, after each shampooing procedure, the aloe vera water. The aloe vera water is contained in a jar, in a small plastic jar which has a purple top. So this has to be applied with your clean fingers to your planted area after you've done the shampoo morning, evening. Just remember that once your shampoo procedure is over, you have done the blue spray from 2 feet away, wait for the blue spray to dry, and then with your clean fingertip you apply the aloe vera from behind forward over the planted area, making sure that every time you dip a finger, it is a different finger and not the same finger to avoid contamination. Now morning evening shampoo is a constant. On the 6th day after the procedure, in place of saline, suppose your saline solution finishes, though we've given you about 6 to 8 saline bottles, if it finishes, you can take a regular bottled water, half a liter bottled water, don't open the cap, make a hole with the needle that we've given you so that it emits a strong jet. But most of the times the saline bottles do not run out. You have many of them still remaining and you can continue to use them without the necessity to buy bottled water. With the morning shampoo, you will apply Gillette shaving foam. Now the crusts have developed and we have to remove the crusts at the fastest possible so that your hair grow well. Now with the morning shampoo, once you've done the shampoo, you washed your shampoo off, there's no need to dry it. Take a thin layer of Gillette shaving foam after shaking the bottle, a thin layer over your fingertip and apply it from behind forwards over your hair. Wait for 5 minutes, let the Gillette shaving foam act on the crusts. It will try and absorb the crusts, it will loosen the crusts and try to remove it before 2 weeks. After you have waited for 5 minutes, you wash the Gillette shaving foam off with a strong jet of saline or bottled water and then you dab it dry, wait for 2 minutes, do the blue spray and in the end the aloe vera water. The same care continues till the 14th day when the crusts are supposed to come off. Suppose your crusts have still not come off, still you stop all this care on the 14th day. 15th day onwards, you will go under the shower, you will use Johnson Baby shampoo twice a week over your planted area and the rest of the head as well. On the remaining days, you can wash your hair any number of times but without shampoo. And in the morning, you will apply a thin layer of Johnson Baby oil over the planted area. So this is the care for the planted area. Now we'll discuss about the donor area. The donor area dressing will be removed after 36 hours. In case you are in Chandigarh, we will remove it for you. Otherwise, it's very easy to peel it off because by that time the donor area has healed very well. So once you have removed the dressing, clean with a sterile gauze the donor area and apply morning, evening tea-bagged antibiotic ointment over the donor area with your clean fingertip morning and evening and let it remain. This will continue for 2 days more, that is a total of 3 days. 6 applications, and this is enough for it. After 3 days are over, you will apply aloe vera lotion over your donor area morning and evening with your clean fingertip. Be sure that you do not vigorously massage the donor area with aloe vera lotion, otherwise you might experience pain. This will continue morning evening till 2 weeks after the procedure. Now that is the care after the hair transplant is over for the first 2 weeks and thereafter. Thank you.